Hey guys, Kim here, and you are tuned back into Kim E, the Diabetes MP, a place where nurse practitioners can improve their diabetes management and education skills. Today, we are going to talk about goal setting for your patients. Now, last week's video, I talked about goal setting for the nurse practitioner, and if you have not caught that video, I'm going to link it right here and in the description box because I want you to put a pin in this video, go watch that video, and then come back and watch this video because I'm not going to go into as much detail as I did in that video because I went through what SMART goals were, and we're going to just keep it moving, but we're going to talk about the goal setting for our patients. So if you are interested, keep watching. We're going to get into it. Let's talk about the importance of goal setting with our patients. Now, the key word there is with. Okay, did you see what I did right there? With, okay? Now, we want this to be collaborative, not authoritative. We don't want to tell them what they need to do. We want to collaborate with our patients because at the end of the day, guys, this is their health, okay? This is their plan of care, okay? We can't make them do anything. They really have to participate in their health care. They have to be bought in to all the interventions that we may have to do, okay? So you want to make sure that you're doing this in collaboration with your patients. You don't want to set goals that your patients are not going to even try to achieve, okay? And that may be that you may have to scale back certain goals. You may have to break down goals a little bit more and make them more of a workable action plan for them, giving them small, digestible, bite-sized steps to get to the bigger goal. But you want to make sure that you're doing this in collaboration with them. Now, one of the things that I definitely would encourage you to do is that now that we are in a new year, a new decade for that matter, use this time when people are the most motivated to get some good goal setting off the ground, okay? Everybody, every year has tons of goals. They have tons of resolutions. Ride the wave, guys, okay? This time is probably when you're probably gonna have your patients the most motivated. And so when you see them come into the office, then this is a great time to sit them down and to actually have some good talk about setting goals for their health. Now, of course, a common way to set goals for people, a way that you can measure goals and add in interventions is using SMART goals. Now, in the last video, of course, I talked about that more in detail. I will briefly explain what SMART goals are. It's an acronym. The S stands for specific. The M is for measurable, the A is achievable or attainable, the R is for relevant or realistic, and the T is for time sensitive or time bound, okay? Now, this is a great opportunity where you can sit down with your patient and you can fill out the goals for them. And again, just like in the last video, I'm going to link down in the description box a free PDF that you can download on your phone, or you can print out and you can fill it out with your patient. You can explain to them what SMART goals are and they can do it for themselves, okay? One of the things that I do want to add on to is that there has been an addition to SMART goals, and it has been called smarter goals, okay? So you have your SMART, but the part, the ER, stands for evaluation and review. So this is something that is very important with your patients, especially because as you're setting these goals, you want to have periodic times where you are evaluating the effectiveness. You want to review because, again, like I mentioned earlier, you may set a goal that may be a little bit more stout, a little bit more dubious for your patients than you thought. It may be something that at first you might have thought, okay, this is something that's definitely doable and achievable for them, but then as you're doing it, you realize, okay, this may be a little bit too much for them. We need to break this goal down. So having that periodic evaluation and review is going to be key for your patients so you can make sure that you're setting them up for a win. Now, let's give an example of what are some good SMART goals for your patients. Again, keeping within diabetes because y'all know that's what I do here. Some of the things that you can help your patients set their goals in is like weight loss, okay? Losing weight, exercising more. The diabetic needs to have that activity, that consistent activity, actually. Something else that you can have your patients goal set in is self-monitoring their blood glucose. You know, I will take my blood sugar once a day for the next 6 months and I will report that to my provider. You know, that is something that is very achievable, you know, and that gives them a small step, a small tweak that will lead to a huge peak, guys. Okay, guys, we are done. That was a short and sweet video, but I hope it was informative for you. Again, down in the description box, I have linked a free PDF that you can download and print off for you and your patients that you can go over SMART goals and fill it in as needed. And if you have not, do me a favor and go ahead and subscribe to this YouTube channel. Ding that notification bell so you will not miss a download. Also, as well, if you're not already, follow me over on Instagram at the Diabetes MP. And again, you have been sitting here with Kim E, the Diabetes MP, and I'll catch you on the next video. Bye.